What's up YouTube, my name is Zarpletan, but you maybe already know that, or maybe not, and I'm just assuming too much. Anyway, today we're going to travel through the world of medicine, surgery, anyway, that's it. And we're going to make a surgery to let's go to this one and this one. Exactly, the one that I wanted. Yep, that's the one that I wanted, for sure. Don't fucking know what that is. So let's make a little read first before you scrub in. This surgery may contain graphic procedures inappropriate for child or squeamish adults. Anyway, you then tell me what that is. SurgerySquad.com is not a substitute for a professional medical advice. Damn. Let's begin this shit. Start! Visual graphic sponsored by. Let's begin this thing.
Welcome to Surgery Squad's virtual laparoscopic RNY gastric bypass surgery. I'm Dr. Jeff, and I'll be your guide for this procedure. Are you ready? Let's scrub in. Gastric bypass surgery is designed to assist an obese patient in weight control. In this operation, we'll create a very small stomach pouch from the existing stomach. We'll then attach the reduced section of the stomach to the small intestine. There are several common types of gastric bypass surgeries. We've recommended laparoscopic RNY gastric bypass surgery for our patient. The procedure will usually take 2 hours to perform, but with skills like mine and the magic of the internet, I bet we can whip this stomach into shape in about 5 minutes.
Oh, that's good enough.
Our patient has been prepared for the procedure with a mild sedative, and now the anesthesiologist places a mask over her nose and mouth, and she'll drift off into dreamland.
Yay!
From here, we'll place an endotracheal tube down the patient's throat. You're up. See if you can get the tube into place.
Let's put the tube into place. That's easy now. Easy.
Great work. This tube is then connected to a respirator. The patient is ready to go. Now we can begin our laparoscopic procedure. The first thing we'll do is make 6 half-inch incisions in the abdomen. Slide the scalpel in where I have marked to make the incisions. Be careful, these are small incisions. Don't get carried away.
Small incisions, I see what you mean. Warning. Ready? 6 to go. Perfect. Next, doctor in the earth. Dr. Zarpy is on duty today.
Nice technique. You must have an excellent teacher. Oh wait, that's me. Next, we'll place a device called a trocar into each incision.
He thinks he's the best. I don't see why. I'm just putting these things.
These devices allow us to easily slide the instruments into the abdomen. Some of the instruments we'll use include a light and a camera, so we can see what we're doing on a video monitor, as well as the surgical instruments, such as the stapler.
Of course, everyone knows what the stapler is. Plug him to the matrix. Let's plug him to the matrix. One connection left.
Now, to give us plenty of room to work, we fill the abdomen with carbon dioxide.
Just as I said.
Let's face it, with a newbie helping out, we'll need all the room we can get. Time to start the gastric bypass. We'll use this monitor here to see our work. In RNY gastric bypass, we eliminate up to 90% of the stomach by making the patient's stomach the size of an egg. We do this by first placing a line of staples that separate the smaller new stomach from the whole old one. Then we sew along the staple line to make sure there are no leaks. As the patient heals, scar tissue will form to create a permanent separation. Click the stapler where indicated to create the new stomach pouch.
Right here.
We'll now separate the small intestine from the old stomach, about 2 feet down.
Here?
The lower part of the intestine will be connected to the new, smaller stomach with a half-inch opening between the stomach and the intestine. It's kind of like rerouting traffic on the 405. Use the electrocautery device to create a half-inch opening where indicated in the new stomach pouch.
Hardest game ever.
Now, drag the loose end of the intestine to the new stomach pouch to attach it.
I'm going to pretend that I understood that shit. These? Oh, wait. So I have to grab here and bring it over here. No? Here. Oh, of course. Of course.
I'll add some sutures to hold it all in place. Because we need the secretions from the old stomach to assist in digestion, it gets reattached to the small intestine several feet below the new stomach. This part takes some guts. I need you to drag the free end of intestine attached to the old stomach over to the spot on the small intestine where indicated.
Okay, I'm going to grab this and put this shit over here. Wait, over here. There.
Again, I'll suture it all into place. The new smaller stomach pouch was created. Everything has been reattached, and we checked for any leaks in the sutures. This new configuration allows our patient to feel full sooner when eating, but also lets the fluids from their original stomach aid in the digestive process. I'll need you to remove each of the laparoscopic instruments and trocars.
Okay, let's remove this shit, this shit, this shit, this shit, this shit, and this shit.
Now we need to suture each of the incisions.
Okay, let's suture this shit. This one. With my octopus
Nice
legs.
work.
It's
I bet that won't even leave a scar.
No.
Now
Sorry
our
about
patient
that.
goes off to recovery. In most cases, they'll spend a few days here in the hospital so we can monitor their progress. Afterward, our patient will meet with her doctor and a nutritional specialist. They will assist her with her new lifestyle and eating habits. You've been a great help. Why not try another fantastic surgery at surgerysquad.com?
Well, I'm tempted. I'm tempted. To be honest, I'm tempted. I don't know what you think about this one. It looks utterly tremendous, disgusting, shit, things. Let's play it. With a big smile on our face. No? Okay. A little 62% seizure and waiting. Waiting. I love loading screens. There we go.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff,
Hi,
and I'll
Jeff.
be guiding you through this procedure today.
Good.
An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe.
Oh.
When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail.
Oh.
An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed
Yeah.
toenails, Foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself.
Okay, Jeff.
If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately.
You listening?
Now that you understand the causes
Good.
of an ingrown toenail, let's put on our gloves and remove one.
Let's do it.
Our patient is ready, so let's begin by disinfecting the toe.
Give a new shake. Let's disinfect it. Okay.
Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Let's apply the anesthetic. Here. I say here as an expert medicine, and I say here. Bleeding is totally normal. Don't
Great.
be afraid.
Now we'll wait a few minutes for the toe to get numb. Now that our patient's toe is numb, place the special tourniquet around the toe. This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to removing the ingrown portion of the toenail.
That's truly important, that thing. Don't try this at home, remember.
First, carefully slide one blade of the nail anvil under the affected nail.
Carefully. Carefully.
We're going to go down the nail until we feel a little bit of resistance.
Yeah.
Our patient's going to feel some pressure as we cut away the ingrown nail.
Go ahead. Oh, damn, that is hard, man.
Great. Take the forceps and carefully remove the ingrown nail.
No, no, no.
It's getting kind of messy in there. Let's clean up that blood.
I thought it would be worse.
See that small bit of pale yellow substance right there?
Yes, I see.
It looks
You
like
see
the
it?
patient has a bit of infection in the toe.
Damn it.
Firmly squeeze the edge of the toe to get as much of that infection out as you can.
Let's squeeze. Damn. I don't recall them being so white. Is them so white? Are they so white? No? No.
That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that the problem of ingrowth will not reoccur in this toe.
I think that's a good idea.
When you're done inserting the acid, I'll remove the tourniquet and we'll finish up. Finish by applying some antibiotic ointment on a sterile gauze pad.
Dr. Chef's been antibiotic cream. Like that.
Place it against the toe and wrap it in a gauze bandage.
Perfect.
Fantastic job!
Hey! 5 stars!
Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics.
Antibiotics.
We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and
Clean it
replace the
regularly.
bandage 2 to 3 times a day.
That is sad.
While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly
Poor
trimming his
guy.
toenails, and keeping his feet clean and dry.
That's good enough.
And that's how we remove an ingrown
Yay!
toenail. You did a great job today.
Thank you, Jack.
While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Too tempting, Jeff. It's too tempting. But not for today. So guys, if you liked it, be sure to like the video, to subscribe to my channel, to say what other surgeries do you want to see. If you want to see another surgery, of course. You want to see it, don't you? You want to see it, I know you want. And that's it. Oh, another thing. I'm going to try to do a new thing that's mimicking famous YouTubers. I count on you to tell me what famous YouTubers would you like me to see mimicking, copying, I don't know. Call it whatever you want. I hope you have understand the concept. Zarp is out.